Okay, well, welcome back, everybody. Another episode of the Reiki Lifestyle Podcast. I'm here, of course, with Colleen.
Hello.
And today we're really excited to have Kae Fink. She's also Karen Fink, in case it comes across the, what official things, Karen, but she goes by Kae. So we're excited to have you here, Kae.
Yeah. Thank you.
Yes.
I'm excited to be here. So.
Yeah, well, and we were talking a bit before the recording about how I came across Kay and was introduced to her. I attended the Center for Reiki Research Summit that was last fall, right? I think.
It was June of last year.
Oh, okay. So it was almost a year ago.
Yeah.
Yeah. And I just found your presentation, and then also you had a lot of feedback in the group and during other presentations. So it was really nice to hear your perspective and your information about introducing Reiki or having Reiki in medical settings. And so I am excited to have you because I know this is a really big part of the Reiki industry, for lack of a better word. And lots of people not only have interest in this, they want to do it, they've had experience of it, whether it's in a hospital setting or in a medical setting through their own lives, their own, experience of it, or it's a part of the reason that they got into Reiki, or they're a nurse, or, some sort of person in medicine, and they want to bring it into their place of work. And so I think it's such an important topic because all of that and your work, what you've done, which you work through University Hospital Connor Integrative Health Network. So I'm going to have you explain that because you're going to do a better job of that. And so I think it's just going to be really helpful to hear all of this information that you have to share.
I just want to say it's Connor Whole Health now. We went through a name change.
So okay, great. Thank you.
Really embrace the whole health of people.
Love it. And that is in Ohio.
Yes.
Okay.
Yes.
Great. Well, so Kay, why don't we just go ahead and get started with your story? How did you find Reiki? And then we're definitely going to get into how you brought it into this medical setting that you're a part of.
Yes. Okay. Great. Well, healing arts go back a ways in my journey. I was the family caregiver even as a child, helping with my mom who was ill, and then taking, like, I would be asked to massage my dad's feet, or things like that, and it just was something that people saw in me. When I babysat, I was able to get kids to relax by just kind of rubbing their feet or doing something with permission from their parents. And I headed towards a musical career. So I went to a conservatory in Cincinnati, the University of Cincinnati, and just didn't resonate with playing for a grade. And I ended up in nursing school.
Oh.
And my first, so I was a transfer student. So I ended up in the summer class, and I came upon holistic nursing on a film strip. Actually, that's how old I am. And got really into that, and was able to apply the relationship-based care of holistic nursing along with some complementary modalities, they were called at the time. Now they're integrative. And to be able to help my patients, besides the medical interventions, something to complement that didn't take the place of it, or, just was able to come in and aid them in feeling better with those complementary modalities. But also, I found that the relationship that you build with the person also has a healing effect. So that's carried through my journey. And then spent some time in nursing at one hospital and switched to another. And I came into another hospital, which it's not where I work now, not at university. It was a different hospital system. And it was a rough transition. And I was having some, um, difficulties fitting myself into such a large institution. And I was talking to a friend, and she goes, "Why don't you go get a Reiki treatment at this college in the area?" And a bunch of practitioners will work on you. It's like a multi-practitioner, session. And I did, and it changed my life. And within 2 months, I was registered at massage school, which I had been putting off for quite some time, trying to pay off my student loans, going out, it'll get there eventually. And it changed the trajectory of my career, of my life. I ended up finishing massage school, and then I attended Reiki training. Um, and I attended Reiki 1 and 2, and um, after 2, I said, "I don't feel like a Reiki 2, I feel like a Reiki 1.5." I didn't feel like they totally trained us, and I started teaching at a local community college, and there was a health fair, and I passed by this booth, and I was drawn back to it and met my Reiki master and studied with her, went through 2 again, and then master several years later. I didn't want to be a master right away. I wanted to live with the Reiki and really treat it like it was a master's art, and not just go right into that master training. And from then on, I've been teaching, and I taught at the one healthcare center where I actually transitioned into as a holistic nurse position through integrative medicine, and then through spiritual care. I worked with the spiritual care department, and it was a healing service that we did. Um, there were nurses and chaplains that worked together. It was really neat. And then I transitioned to University Hospital, and probably 3 years in, they changed my role and asked me if I would lead the Reiki program that they wanted to start, a Reiki volunteer program. And we started training sessions, and our first volunteer started on the units March 31st, 2022. And it was in the cancer center, the Seidman Cancer Center downtown. And we've been adding to our numbers as well as our locations. So we added another location of a cancer center. And then about a year and a half later, I asked if I could start thinking about inpatient. So we now have an inpatient um, using healthcare professionals who want to volunteer, such as you said, nurses and other healthcare professionals who have inpatient experience. Um, so it's just manifested into going system wide, where we've just started another location with some uh, outpatient pre-surgery department that because they didn't have a Seidman Cancer Center available. And it's to me, it's been a real gift to be able to not only practice Reiki on myself, because that is what you need to, or you not need to do, but what is best to do to keep you in your self-care mode and to keep you at your best, but then to provide it to other people, and then to teach other people how to provide, and then create this community of Reiki providers um, that are so wonderful. Yeah. And that not only teaching them the Reiki, but teaching that relationship-based care and being able to connect on a deep level and talk to people and just hold that space, for the healing to occur. Yeah. So,
Wow.
mm.
So currently, the providers that are in the system are nurses that then learn Reiki.
Um, for the inpatient, but we have community volunteers and
Okay.
community members who can come in, and we place them in the outpatient department.
Okay.
Just because I felt that people comfortable on the inpatient, it's a lot different being on an
Mhm.
inpatient department than an outpatient department, and so that placing people, in their comfort zones will help them. So to
Yeah.
be
And
to more present.
and also knowing protocols and things like that, it's so much easier, I would imagine, to not have to teach that in
Yes.
addition, like they already know all of
Yeah.
those protocols.
Yes, exactly. So
So
yeah.
your classes, do you have 2 different classes where you teach like the nurses that are in the in-person and the outpatient, or is it?
No, they're combined.
Mhm.
Anyone can attend. Uh, it's everybody's at the basic coming into the intro first degree training. And I believe that it helps to have nurses and community or healthcare professionals and community members, because um, the healthcare professionals are very comfortable in that situation, and they can be mentors. So I love that, being able to um, combine that. Also, then creating Reiki shares at the end of the class time for a couple hours, hour and a half to 2 hours, allows me to create that community so that people have connection and they can tell their stories, they can talk about their challenges, and then they can also practice on each other. So, and I think creating community and relationships is so important, as well. So,
Well, I think the community aspect of it is, it sounds like that's really, top top two things of importance. I think I'd like a little bit more clarity on, so
mhm.
you have a an outpatient. What does that look like? And then the inpatient. So what does the outpatient actually look like? Say for people that may even be in your area to receive or even to want to volunteer.
Yeah. Well, the outpatient centers, we are we really began with the Sideman Cancer Center at our downtown location, our main campus, and then moved to Portage. Um, we're expanding out, so as interest occurs in the different locations, we're open to starting programs there. And it basically, it's about rounding, it's about checking in, with the leadership there, letting them know they're there, rounding on the patients, and just introducing the services. uh, I tell them that it's a success if they say yes, and it's a success if they say no. A lot of patients do not have the ability to say no to a lot when they're receiving oncology treatments. They can say no, but it's far and few between that I've seen. But in this case, to be able to take that autonomy and their intrinsic power to say no is also nice. I think that's healing as well. So, a lot of people would say, "Oh, well, patients say no. That's a failure," but it's really not. It's a success for them, for the patients, and to celebrate that and make them know that that's okay. To give them that sense of power, and then the ones that say yes. We offer 15 to 20 minutes because, as you know, patients who are receiving treatment, it can be depleting and they have symptoms. And to be in someone's space that long, more than 20 minutes, can be tiring. Or we also give them the option to stop when they feel they've received enough as well. That rarely happens, but it happens. And then we set up basically they can play music. We ask them if they have their own like music list because of what they like. I've had people not want relaxing music. At one point I actually had someone have heavy metal, and I'm
I was
like,
just gonna
okay.
say.
And that patient's pain and anxiety came down way, like 8 points on both. So they didn't resonate with the relaxing music. We try to keep it where there's a standard operating procedure where we don't offer things, uh, you know, modalities or anything other than the Reiki. We kind of keep it pure. And we definitely do training on, we kind of role model how not to get caught up in conversations that might ask questions that we can't answer, and that we just say, that's something to check with your provider, because patients will ask about medications, they'll ask about nutrition, and we can't talk about that and we can't, and they'll ask questions like, well, what did you feel and what does that mean? And we could say, well, this is what I felt, but I can't really judge that. It's just what I felt. What did you feel? And to get them to talk about their experience, instead of like, there's no diagnosis, there's no, um, assessment of what we felt. It does not correlate into something, that they may be going through, so we want to stay away from that and kind of keep it of their experience. We also have a pre and post survey for measuring pain, anxiety, well-being, nausea, and fatigue, so that we they can see where they were and where they are, and to let them know that if things don't change, that's okay, and if things change, that's okay. Um, and then we've had some statistically significant changes. So, 1 point difference, I believe, is significant, and we've had some really good, changes. And then we also have some great narratives. So we actually ask them to make comments if they want, no pressure. And patients, and I think Natalie covered that and when she presented the article that, or the research that they had done retrospectively. So I think you were there for that as well. And some of the comments are just amazing, you know. So, um,
Well, we had a volunteer program here in Portland. For a long time, it actually ended up kind of phasing out during the
mhm,
pandemic and then, you know, restarting it up. The person who was leading it wasn't really able to do that. So I also volunteered at times, and we went through a specific volunteer training,
mhm,
um, both for Reiki and for the facility. Each
mhm.
had their own of appropriate language to use, definitely things not to say.
Yeah.
Um, we practice such a spiritual style of
Mhm.
Reiki, and yet making sure that we stay within the scope of the person receiving, so we're not going beyond their belief systems or even having that come into question.
Right. Yeah. Part of the training is Reiki and the relationship based care. Part of it is ethics. We have, how to navigate in the hospital setting. And then when we set up their orientation mentorship uh, time, we go over that as well. I have a standard operating procedure that's 3 pages long, and just to set those parameters. Uh, that's what we expect, and people have not strayed from that. It's amazing, and there's been nothing but positive from doctors, nurses, healthcare professionals, leadership, and the patients. So it's been an amazing experience. And The inpatient program also, I presented it, and at the end, the director was like, "So when do we get started?" And we really just started in April of this year, and we're working in the women's health area right now, but there's interest in other areas. So it's and basically it's the same thing. We round on the patients. We now have flyers that the nurses can hand out to patients when they're admitted or sometime during their stay, and the volunteers can hand those out, which explains further um, than what the volunteer might say at the beginning of a introduction. And it's being very well received, and the people that I'm bringing on to volunteer are just thrilled. They're thrilled to be here, and just
Oh, I bet to get
amazing. You know.
to I'm certain just even being in this style of
Mhm,
healthcare or wellness care, I'm certain as people who have gone through all of the nursing and the caregiving that is, like you say, natural to them,
mhm,
probably from childhood
mhm.
and all the way through, to be able to really treat the whole body in this way
Mhm.
and not be, only driven by what does the chart say? What do
Yeah,
I put on the chart? I've got
right,
this amount of time with this patient, now I have to go,
right.
so.
Yeah, and basically, what was I going to say? We we speak an integrative language, so we're not coming in, um, saying things that might put people off, but we're also not speaking in such a medical way that people don't understand, that the we're speaking an integrative language. This is here to support you. This works with your medical care. This enhances or supports what you're going through. You may find yourself feeling better, more balanced, more relaxed. It's been known to help with some side effects, but we don't guarantee that. We say it promotes. We don't say it gets rid of your pain. It promotes pain relief. It promotes comfort. It promotes well-being. It can promote relief of symptoms. So we um, don't set expectations that we can't match. And we also say, it's you who are having the healing process within you. We're here to promote that. We're here to be with you on your journey. And the one of the things that people find interesting when they come for training is how many things can you do where you receive as you give. So as you're giving, you're receiving. And so I've taken that to almost every aspect of, my teaching is even at work when you're not doing the healing work, if you are in relationship with a person, a patient or a colleague, and it's a positive experience, you're going to benefit, like the psychoneuroimmunology, your mind body connection, the chemicals that are released, in that relationship, providers as well, doctors, nurses, having those interactions with patients as well. So I promote that as well when I'm teaching. So I got it from the Reiki. It came to me through doing Reiki and through teaching Reiki, but it can really permeate any aspect of healthcare if you have that mindfulness that you're in a relationship that's positive with a patient or a colleague. So I love that aspect. I do focus
Well,
on that in my teaching with the Reiki
the
provider.
receiving, because commonly we are a group of overgivers.
Yes.
And so a modality, because the energy, like you say, the Reiki energy we actually receive as we give,
Mhm,
even as we're learning about that.
mhm,
So we don't have to know that that's what will happen as
mhm,
much as then we experience it
mhm.
and know about it because we've now had the experience of it.
Yeah, I actually was doing a well-being moment because I'm a well-being ambassador through a healthy program that we have at work. And I said, so when you have a positive experience with a patient, how does that feel within you? And people were like, oh, and they thought about it and resonated and then reflected and came up with some really interesting answers. So it was a really good um, interaction that we had that day. It was just at the start of a meeting that we do every month. So,
It is such a important population to also be able to receive nurses and
mm-hmm.
medical staff, and because it is such a challenging
Yes. Mm-hmm.
job
Mm-hmm.
and overgiving and work, and
Yep.
just there's so much care
Mm-hmm.
that and overworked, I'm sure, with staffing shortages and things like that that are now at least a
Yeah.
commonality in the medical
Right.
industry from what people say.
Yes. Mm-hmm.
So it's good that
Yep.
they're also being able to receive.
Yeah. So our program, and I'll just say our program started with a philanthropic gift from the Connors. The Connor Whole Health is um, that umbrella, and um, it's so it's been an amazing experience. But patients are our primary recipients, but again, if you round and patients and families have been taken care of and you have time, they allow for us to take care of staff. And it's um, again, we're finding their pre and post, measures are amazing, and the comments we get are amazing as well. So there's that. If you think about whole health, it's not just about the whole health of the patient. When we're caring for people, we need to be in our best health so that we're able to care for those patients and create that therapeutic environment and, you know, um, being able to receive Reiki and then be interested in learning Reiki, even if they want to just give it to themselves, is kind of amazing. Um, uh, and there are staff who have asked to train, and then want to volunteer and give back. And then there's another program that I started was patient and family Reiki training so that a patient can receive in between sessions because maybe they can come once a week, maybe they only come once a month, but you pair up with someone in your family or a friend. It doesn't have to be family. We just call it that. And we just finished our first training. We had 2 4-hour sessions. We just finished on Saturday, and they're tales of how they've been using that since the first session has been and how it makes them feel, and it's pretty amazing.
So in that example,
Mm,
I'm sure it's broader than this.
mm,
Uh, they come with a friend or a family member so that that friend and family member can give
mhm,
the patient
mhm.
Reiki as
Yeah,
well as self Reiki, it sounds like.
self Reiki. We practiced seated Reiki with each other, and then lying down. They all have tables. They
Mhm.
came in there like, well, we have a table, and the other couple said, well, we're getting one, and I was like, wow. So they were very into it, and starting out small, but you know, mostly the oncology patients I've offered it to at this point. And so we'll start a second class. We'll have one every quarter, along with a volunteer class every quarter if there's the numbers. So yeah, it's pretty awesome.
Well, when I did the oncology, um, going back to the results,
Mhm.
because the same thing, even though it didn't qualify as a scientific research paper, the results definitely showed with the scale of 1 to 10
Mhm.
stress reduction, 1 to 10 pain reduction.
Mhm.
And like you say, in 20 minutes time,
Mhm.
people would be receiving
Mhm.
significant changes
Definitely.
really every time.
Mhm. Yeah.
I know I remember one woman in particular, and when they're and I think you're describing the same thing. So in this case, we were actually giving Reiki while they were in the recliner receiving the chemotherapy. And so we can only reach, maybe one spot or even sit back and send it with our hands
Yes.
towards them. And one woman, I was able to touch her leg and didn't know. And afterwards, she said she had not been able to be touched in maybe 2 years
Mhm.
and that it actually felt good.
Yes. Mhm.
And like you say, for me, the experience of that, the receiving part of it was just the joy I felt for her.
Mhm. Yeah.
Have that difference and the relief in the moment of just being
Mhm.
able to be touched.
Yes. It's yeah, the just, being able to be in that moment and witness or hear how they've experienced it. And then to kind of take it to also now, how do I feel when I leave? And I'm the provider. And wow, I feel better every time. I feel a little bit better. I've had people, say, yeah, I didn't really think I should have come in. And then I grounded. So I felt okay. Because I always tell them, if you're not feeling good, you can cancel. You'd be better to, take into the interest of you and your patients, you know. But they'll say, or I just kind of, I felt okay, but I felt great when I left, and it's it's just amazing, that it has that effect on both the recipient and the giver. So,
Well, and sometimes you're in your busyness,
hmm
and it's one more busyness. I'm going to go volunteer, I'm going to go help. And then you leave just in that sensation of receiving as you've given. And
hmm
the depth of, I think for me too, expanded awareness,
hmm
the expansion of just that that sharing, like you say, that relationship. And sometimes that you meet them one time
hmm
and not again,
hmm
and still that connection is there.
And the beauty is that on the same day providers go, they're scheduled, and they have patients who schedule every Thursday or every other Thursday or Thursday once a month. And we've had people have, I think, up to four when they had done the retrospective study, which cut off at a certain point. So we've been going strong since then as well. So, but it, it's amazing some of the comments that you hear from patients, like, I just can't wait till she comes back again, and I never thought I would do this, and it's been a blessing. And there's just so many narratives that we've gotten as well. um, and to make sure that everyone understands, a retrospective study means that you get an IRB approval, so you get approval by your health the healthcare service, you're in a healthcare setting, and so they can go back and look at de-identified information. So nothing that would identify a patient is just those scores and those comments without attaching it to anything and a person. So it was a really great um, article that they published just recently in January or December of just past.
Is that an article people can read? Is that
Yeah,
published?
yeah, yeah, it's published. So,
That's through the Center for Reiki Research that people can read it. or easily find it? Do they link to it?
Yeah,
Where?
maybe there could be a link.
Okay.
Do you have links once we
Yeah.
post this? Yeah,
Yeah.
maybe we could send you the copy and people could,
Perfect.
yeah,
Fantastic. Yeah,
that's okay.
people can
Yeah,
find it in the show notes or the
yeah.
description.
I'll check and make sure I have permission for that. But yeah,
Yeah, of course. That makes
yeah.
sense. Yeah.
And it was just it's just amazing, and to be able to not only bring it to the hospital, but to add to that evidence-based knowledge
Yeah.
to support Reiki being in the hospital. It's just amazing.
That's one of the things that I kind of want to get into, Kay, and one of the things that I really learned, there's a few things that I learned in the conference last year, but that I would like to hear from you around. What the first one is languaging, because even since we have such a variety of perspectives that listen to this podcast,
Mhm.
as a community, it's also really helpful to support the people that want to bring it into the sciences, the medical settings, things like that.
Yeah.
So, what are some of the language that, even like, even though Colleen and I practice really
Mhm.
spiritually, what is some of the language that we can use and that we can give to our students to use? Because integrative was one of the big ones that I learned.
Right. Yeah. Integrative is very appropriate. It's being able to show that there's this supportive therapies that can come in and work within the medical situation. So it integrates instead of being alternative. We used to use the word a long time ago, alternative therapies. Um, if I were a medical provider, that would put me off a bit
Mhm.
because you're going to have an alternative to what we do. And integrative means we come in and integrate. So we come together and support each other. And there's a common language. We tend to, so the common language to introducing Reiki, is that what you're kind of talking about?
Yeah, yeah.
So what we do is we talk about balance, the system. Uh, we don't talk a lot about energy per se. Like I tend to bring it in as you've seen a heart EKG, you've seen a brain EEG. That's energy. We're energy beings. If someone asks, but basically, I we talk about it as balancing the system, especially like the neuro system, which is our energy system, right? And we talk about instead of curing, or actually we try to stay away from being using the word healer. We're not
Yeah.
healers. We are, you could be an instrument of healing, you could be the conduit through which Reiki comes through. We tend not to say we're healers because the person's the healer, and what we're doing is tapping into that inner healing and giving providing the Reiki, which can promote that inner healer of their own inner healer to be able to, create that healing within. And that's why we say promote. We don't say it will. I've listened to other people describe it in other healthcare settings, and oh, it'll help your pain and it'll help your anxiety, and I think saying that sets an expectation that their anxiety and their pain will go away. Sometimes pain is not something that goes away because it's a necessary stimulus, at that point. It may, I use the word comfort a lot, promoting comfort, because if you're comfortable, if your comfort level is higher, you're going to experience your pain differently, right? And it'll set you up, to, you know, be in a better frame. So using the word promote is comfort for me, like a comfortable word for me. We try to just really set expectations that are, people say, well, what am I going to feel? Well, you don't want to tell them they're going to feel a lot of different things because they may not. I've had experiences where I've introduced Reiki, and they'll say, well, I don't do Reiki because someone told me what I would experience and I experienced none of that, and then I'm a failure at Reiki. And it's, to get that back, I've said, how about you just experience it with no judgment whatsoever and just experience what you experience. And I even said that, I even say that some Reiki masters don't feel a lot, and that's okay. And they've been doing it for years. I said, it's not really about what you're feeling. It's about that you're benefiting regardless of whether you feel anything or not. You're being set up to being in a more healing inner environment, and so we try not to set too many expectations. I think that's the key. We try to keep people from, talking about, that this is the best thing or this is the only thing. That's not, I've heard not only in Reiki, but other healing arts. This is all you need. This is all you need. This is the best. And I tell people, whether you're trained in one method of Reiki or another, because there's many different Reikis, that you accept everybody's, training, and nobody's training is better. And you may want to try other trainings, but you're complete with this one training. You're complete once you've gone through it, because you're tapping into that source, and we're all tapping into the source no matter how you're trained. So, and what,
Just to clarify really quick. So I love that idea of the word promote.
Mhm.
So normally I would say, even in that kind of setting, I would think to say, oh, it's a Japanese stress reduction technique,
Oh, okay.
but I'm now like, that needs to
Yeah.
be reframed, right? Not, it is a stress reduction technique. It can promote stress reduction. It can promote pain reduction. It can
Yeah.
comfort.
Here's I do say Reiki is a traditional Japanese modality that helps to promote balance. Um, it basically provides whatever you need at the moment.
Okay.
And I also say, people go, well, how do I know it's working, or how do I know if it's, every time I have it, it's working? And I say, well, every time you have it, both you and the provider are different. I mean, like, even if it's the same provider, you come in every day as a different, you know, person, because you may have more pain one day than another, or perhaps through all of the healing arts that they're receiving, they're, it's cumulative and they're improving. And so I've had people say, well, my one Reiki treatment was the most powerful at the beginning. And I said, well, that was your first one. That was your first, experience. And every time it's going to be different. So I try to let them know that it's not something they need to judge, that it's just an experience that they have each time. So, yeah.
Love that. So it's a traditional Japanese technique that
Mhm.
promotes comfort and balance. It
Promotes comfort and balance. And then I say it can promote, you know,
yeah.
can promote, but
Okay.
we try not to say it will help. I I tend to stay away from, this is the answer. This is part of your journey and part
Yeah.
of this integration of whatever you need, you know,
Okay.
to support you, and everything that you do is going to, have an effect, you know. Yeah. So,
So I also, one of the things that they asked us not to do is to do things like draw the symbols in our hands
right.
in
Hmm.
front of the
Right.
patient, prepare before you get there.
Yes.
Yeah.
Yeah, we I've had some interesting responses from people seeing some Reiki practitioners in other areas, not at UH, but in other settings, where they're waving their hands or they're drawing the symbols. And we haven't gotten there yet, because first degree training, you don't draw the symbols. But, like, I do have Reiki masters who come in, and we've talked about that. So you don't draw the symbols. You can visualize them. You can think them in your head. I don't say stuff out loud. And then, you know, as far as, like, when at the end, I basically have intend that you're doing that ending without using your hands in a public setting where there's a lot of nurses and things like that. We want to make sure that um, we're providing the Reiki, we're providing the service, the patients are benefiting, but we're not appearing uh, in a way that might put someone off. Yeah. So,
Well, that whole thing led me to the teaching in my classes of first rule of Reiki, never scare the client.
yes.
So, like, don't be doing things that
Mhm.
I call it a weirdometer, that the
Yes.
weirdometer goes way overboard.
Mhm.
And we don't know what that is for some people.
Right.
So, for some of us with more experience, that can go pretty far.
Right.
But in a brand new person, or sometimes there can be, different belief systems that why it needs to be so neutral.
Right.
Reiki doesn't really require us to give it all the definitions or those rituals or anything for it to do what it does.
Right. And that's the beauty of the integrative. We can speak the speak of, support. We're here to be with you. We're here, this is a supportive measure that fits in with your treatment. And yeah, to be able to, that's why I don't stress the energy aspect of it when we're introducing it. If someone asks, fine, have that conversation because they're interested. But at the beginning, I think I had the script, but a couple, someone was saying energy, and they said people said no, and I said, yeah, I think just lead with creates balance, you know, um, and then speak very like not scientifically, but if someone asks about energy, you can say we're all energetic beings. You can see it on monitors, like the EKG. That's your heart rate. That is an energy that you're seeing. Um, and things like that. And it's working out really well. So we rarely have anyone who's put off by it. Some people just don't want to receive it, and that's okay. But it's not because of how we're explaining it, you know. And so there's the intro script is. I said, this is a basis. You can make it your own. We don't have to be robots and say it word for word. But this is just giving you an idea, and then the standard operating procedure gives them parameters within which to work, because I think for a successful program you have to have buy-in from the patients, you have to have buy-in from leadership, from the nursing staff, and um, from the patients as well. So you know
I think it also supports the practitioner to give those parameters
hmm
so, it's clear what they are.
hmm
And, I always talk about staying within the scope of our practice.
hmm
And so coming in with Reiki, you are in the scope of your practice. You're not, you're staying in that lane. So
hmm
having the tools
hmm
explained of what that actually means in the
right.
setting
hmm
has to really benefit the practitioners too.
Yeah, I think it gives them a comfort zone as well. They when they go in, it's all new, and it gives them a frame of reference and a comfort zone. And some people are more comfortable when they go in than others. And my philosophy is the orientation and mentorship. Well, mentorship goes on and on. The orientation's there until you're ready. And I've had several times where I've come in to do two orientations instead of just one, just because to be comfortable and to show that you're comfortable will be um, a selling point to the patients. It will make them more comfortable. If you're at ease, they're at ease. So, yeah. So,
Okay, how if somebody wants to start broaching the subject with a hospital, a medical
mhm,
setting near them, what are some of the things that you would recommend and how
mhm.
they can start broaching that subject or bringing this into the conversation?
Yeah. Well, it's definitely a plus to get leadership support. So to be able to speak again that integrative language, you want to make sure that you're approaching it in a way that's, here's what's beneficial, here are the benefits. This is how we speak about it. It's not going to be an alternative to anything. It's complementary. It's integrative. Um, to find a champion who, is supportive. Um, I've heard of a lot of different volunteer programs. So it's something that, you know, resonates because you know this is being provided as a service that's free of charge, that we're not charging for, that people are wanting to do as volunteers. And there are nurses, there are retired nurses who are kind of contacting us as well, who want to continue being in that setting who no longer work, and so just I think it just basically you need to find that champion, to work with, um, you know.
Can you explain what you mean by that just a little bit more?
Okay. Well, to be able to get into a healthcare setting, you would want to have, well, contacting volunteer services, seeing if that's an option, you know, um, meeting with, say a director of some sort or a physician champion. Sometimes people know people in the community and conversations happen, and then it's all of a sudden like, why don't we, think about this, in the hospital setting? So it's having a plan, having for me, it was they asked me to lead this. This is something that someone um, created, and from the donation from the philanthropic gift. So then that's another area, to have philanthropy, donate towards a program, you know, uh, and I think so. For me, it wasn't me coming from the outside saying, "Let's do this." It was, "Can you take over this program and help grow it?" And I was like, yes, so it just depends on, is this coming from inside the hospital setting, the health system? Is there support for it financially? Is this coming from, my idea and coming into the hospital setting, trying to find that champion? So, but I think a lot of programs are volunteer. Um, I'm not sure of your experience with that and what you've heard. And
Yeah, it was all volunteer.
yeah, so um, and then of course we have the Reiki that I'm providing to clinic patients, as part of my practice as well. So, um, but so there's several different Reiki um, arms to this, So, but the fact that it's in the hospital setting is amazing. So that they're,
Absolutely. Well,
accepting.
and the other one that you mentioned was spiritual care, because that's one of
Oh,
the things that
yeah.
I've noticed here
Mhm.
is, working with Reiki in the oncology department was kind of one frame,
Yeah.
and then working with it in the spiritual care department was another frame. So can you
Yeah, that's another
comment on that?
department to connect with, I would think.
Mm,
Yeah, that's how it was run, like a combination of in my other health system, uh, it was a combination of spiritual care and employee experience. Employee experience is another area probably to consider contacting. So they're always looking for ways to help patients, and you think patient experience, family experience, and then we have employee experience. So um,
Is a university hospital going to be different in your approach than, say, like I know here one of our a
mhm,
few of our hospitals are through, a one's Adventist, one's, those kinds of that might have a spiritual care where a university hospital may have a different way that they're obviously, research and training and,
mhm.
things like that. Do you find that that's the case? Are there different approaches to each,
Um,
or is it pretty much the same?
well, I mean, as far as my experience, we did, yeah, there was our team giving Reiki, and then we had a small volunteer wing at the other healthcare facility, you know, so which I was a part of as well. University Hospital, I believe, is um, yeah, our mission is to teach, to heal, and to discover. Uh, well, to heal, to teach, and discover. We want to put the patients first, and that is how we base the Reiki program. So we offer the Reiki. That's the healing part. We teach the Reiki program. I mean, of course, people can come in already trained. We, we offer anyone and any type of Reiki training that has a certificate that's, accepted, and or that's known, and then the research. So in our case, that's the way we're going, but we also have values such as belonging and integrity and service excellence. Those are 3 of the 5. And we're basing our Reiki shares on belonging, creating community, creating that integrity, that we follow that standard operating procedure, and service excellence, just from the fact that people are responding as well to the Reiki as they are, and so we try to fit our programs at Connor into the system, that we work in, and so that we look at the mission, the values, the vision, and fit within that from all of our programs, at least. So yeah,
That is a really good little
yeah.
nugget there that,
Yeah.
okay, so if there's a certain
Yes.
system or
Mhm.
hospital that you're looking at.
Investigate what is your mission, what are your values, what is your, what do you say to the public to show what you do, and then what are your values, and to, um, similar to when you go on a job interview, you want to
Yeah.
know who you're speaking with, and you want to be smart about it. You want to, you don't go in blind. You want to make sure that you are aware of, what do they stand for, and will this fit in there? So yeah, so that's pretty cool.
And are you a match for it?
Yes, exactly.
And do you want to be a match
Mhm.
with it?
Yes,
Does it
yes,
resonate?
yes. Out of all the places I've worked, UH mirrors my values, or
Mhm.
my values mirrors UH, if you want to say that. So I'm very glad to be here. Yeah. So,
Well, another part of it, I think, that is important for anyone approaching this is also addressing safety.
yes.
That's a big piece of what the leadership wants to know.
Yes.
What do you know about the actual physical safety,
Mhm.
all of the physical protocols?
It's all in the standard operating process
Mhm.
procedure. Yeah. That took me a long time to develop, and it's continuously evolving. And that is why with inpatients, I chose to, for everybody's comfort level, um, to have people who are having had experience with inpatients, who have a license, who've dealt with inpatients, because it's very different than outpatients. You're dealing with a lot of different factors, and I think, you know made leadership comfortable. It makes me comfortable, makes the providers, that are going in as volunteers comfortable, and the patients as well, when they find out, wow, this is a nurse, or this is a radiology tech, or people or pharmacists that have had inpatient experience. It makes a difference, and that takes nothing away from the community volunteers, who are amazing, but it just feels, you know um, I've had people say, I don't think I'd be comfortable outside the outpatient, you know area. And we've actually had volunteers who have different uh, roles, actually do both roles. So they'll do like an activity cart, and now they want to do Reiki. So it's kind of amazing. So we've had some interest from our volunteers who are already volunteering to change what, I've been at the front desk. I want to continue that with the information desk, but I want to now volunteer and provide Reiki. So I find that very, very interesting and wonderful. So yeah.
Oh, we were both.
Yeah, we were both waiting for each other.
But,
Oh,
well, I was thinking of, you know, when I was my mother's caregiver for 7 years, so in and out of the hospital setting. And another thing that's coming to mind with the inpatient that's important with the licensing is even knowing how to maneuver around the machines,
oh yeah.
getting out of the way,
Hmm.
like, okay, I need to move right now because they're all coming in, checking monitors, doing the things, and
Yeah.
now it's time for me to get into the corner.
Right. Yeah, I find it amazing though that the last few times I've oriented someone, we've been in the room and a provider will come in and they're like, "Oh, wait, I'll come back."
Yeah.
I found that in my other practices as well, that when they recognize what you're doing, a lot of times they will let you finish. And, there are times where, we have to move out of the way if a monitor goes off, or, they need to come and check the patient, or, and I said, you know what, it's not going to affect your treatment. You step away, you provide space. They may ask you to step out of the room, and that's okay as well. But we won't ask to stay in the room. But if, a team comes by and they're like, oh, we can go to the next room, we'll come back. How long do you need? And it's like, wow, that's pretty amazing. So, they
So,
find that it is important. You know, so.
so Kay, if you're approaching leadership,
Mhm,
or even somebody who wants to be a champion, or you know somebody that you think would be a good champion, what are
mhm,
some of the things that people should know? I just even you talking about having some of those
mhm,
standard operating policies, like
mhm,
do you and then another additional part of this question is, do you come in with some of the research that has been successful, some of the other places that have been using it, like
mhm.
your system, Cleveland Clinic, some of those kinds of things? What do you suggest people
I would,
have?
yeah, I would do my research. I would see what's around, what people are doing. If I was the one starting at UH, like I said, I was asked, once
Yeah.
the decision was made. So I didn't have to do the homework or anything. Although I did my homework because, how to speak and, the values, and I've already know all of that. Um, but I would, first of all, look up the values, the mission, what the hospital is about, see if that seems like it would be a fit, what other hospitals systems are doing that program, whether it's volunteer or not, or whether it's they're training their nurses to do the work, or in their practice, because that's another component that I love is that could be something in the future possibly is nurses are trained,
Yeah.
you know um, how can they use that? Even if it's just treating themselves so that they're in a better position to handle the ups and downs that happen in your career and at work. But to bring in some of the research, there's some quality research out there. We're hoping that the research that we do at UH is going to add, and the one that we published added to that, and hopefully future studies if we continue, and to have some evidence base. Some studies are stronger than others, and you know, uh, being able to speak their language, I would definitely, um, you know, connect with a mentor. There's several people that I connected with when I was beginning this journey. One was a doctor who was a trained Reiki master as well, and several mentors. My own Reiki master, and I had another Reiki master, and just to perfect the teaching aspect of it, but also to run by, what does this sound like when I speak about Reiki? Does that sound like it's integrative? And just being able to not um, not bring in that alternative concept, to bring in that this is something that can be supportive and be something that can be added to their care plan. You know, so, yeah. But yeah.
Do you suggest having like flyers made, like that kind of thing as well, or do you think that that's maybe on secondary or something?
Maybe an information sheet for the leadership.
Yeah.
Flyers can come later.
Yeah.
Like, because that's when I think of flyers, I think more of like
Yeah, that's a better term. Information sheet.
information sheet, yeah, like something that you can present. Uh, you could make a PowerPoint. I'm big on PowerPoints.
Yeah.
Like, I'll just find a reason to make a PowerPoint. So, but having some facts. You know, um, you can also, if you have a private practice, kind of take people's statements on how that helps them in their life. Of course, if you're thinking well patient versus patients in the hospital, it might be different, but to be able to have some narrative you know that might show the experience you know so yeah,
And
I think it's
make it
basically
easy to
knowing
read.
your audience. Yeah. So
Make it easy to read and quick
yeah.
because they're busy.
Yeah.
And then a follow-up if they're willing to have the follow-up. So make
Yes, exactly.
the
Mhm.
initial presentation enough to have them willing to open the next email you might send.
Yeah. And the other thing the other item when I um, give an in service, which I'm going to start actually, I'm going to record one now because that way I can't be there for every single employee, during an in service. You might hit half the employees or people on day shift, or there's people on evening shift and night shift. So, but being able to present, but also to provide so that they can experience it. One of the volunteers that I have right now was in the audience of an in service, and she came up to me because she was the one that we demonstrated on. She says, "I want to do this," and so it was very amazing to see that, just experiencing that 5-minute treatment. She was like, "Now, how do I volunteer?" And it was very and she's recruiting other people. So I have another person on her unit that uh, wants to take the training. Now they can't volunteer on their own units; they have to volunteer on a different unit, and they are brought on as volunteers. So there's a separate role. They're employees, but then they can volunteer. So, but they have to be brought on as volunteers and on their own time and not on their unit. So
And can they take the training without volunteering, or is it?
right now we're doing um, the volunteer training, which then you make a commitment to volunteer. Um, I'm hoping in the future, we can do more kinds of training. I don't want to like overstep and say that that's happening now, but you know, um, you know, it's on the topics I would like to bring up. So eventually, so
We call that on the list.
yes,
It's on the list and it
on
keeps
the
rising up, and then sometimes it takes a few steps back and then it
list.
rises back up.
Yeah, I think the my priority is the Reiki training, and then the Reiki volunteer program, the patient and family classes. So those are priorities right now. So, but
Okay, do the nurses that you train in Reiki get, this is a random question-ish,
Mhm.
get continuing education hours through your
uh,
need or anything?
that is something also I have on my future list.
Yeah.
So,
Okay.
yeah, so um, yeah, there's so many aspects that um, can be in the future. So
Yeah.
yeah, so.
Well, we used to be able to offer continuing education for nurses with Reiki,
Mhm.
and then the nurses board discontinued that.
Oh, even if they're providing for the patients, not for themselves? Was it more for self-care?
Possibly it's different if it's a
Mhm.
nurse taking
Yeah.
it. For instance, nurses taking it with us, we have a generic form we can give them if their particular board will accept it. But,
Yeah.
for the most part, it's
Mhm.
not system-wide like it used to be.
Okay, got it. Okay,
Mhm.
yeah.
Yeah.
Well, Kay, is there anything else? Like one of the other questions is for people that are wanting to bring this in, but they, hit kind of a skepticism.
Mhm.
Do you consider or do you encourage people in to continue when they're in that kind of environment, or do you think that they're kind of in an uphill battle there?
I think it just depends on each individual who's wanting to start a program and each individual, like, healthcare system. It might be that that healthcare system is not open, but there's other healthcare systems in the area. And then once one healthcare system starts it, it might help to promote,
Mhm.
future healthcare systems, to take on that, you know. So I think it has to be a successful program. I think it has to be, leadership bought into it. It's proving itself. There's benefits, that kind of thing. So yeah. So and
Oh,
like
it is all benefit based.
yeah, yeah.
Yeah.
So it's definitely um, it's definitely proving it where we're at, that there's benefit, to both employees, patients, or patients, families, and employees. So yeah.
Well, another area that I remember talking about, and I'm kind of grabbing a hold of the question as I'm speaking, but also, does it save money? Because that's another part of, what the leadership wants to know.
Mhm.
Some of the studies have shown that patients leave the hospital sooner, they have
Mhm.
less reliance on pain medications. I think that study
Yeah.
was with the hip replacement.
Yeah. Yeah.
Yeah.
I think basically more studies, more evidence based, uh, the really strong studies that can show that. Yeah. So um, and I think that we're good. We're getting there. It's a process. But you know, we do have some of the narrative that we have. Has shown that patients are more comfortable. They're less anxious. And that's a benefit within in themselves, because if you decrease those symptoms and you have better quality of life, you know it just has to be documented, and more research. The more research we can get, the better. And that's why I really um, feel that the Center for Reiki Research is so important, and all the research studies that have been done, and the ones that are going to be done, and looking at it from different perspectives. You know, um, whether it's you know quantitative is great, qualitative, quantitative, mixed studies are wonderful, because it's not only the numbers, but you hear the stories, you hear the narrative. You get it's a richness that you get with that. So you know
Mhm.
so
Absolutely. Well, again, holistic and the holistic
yeah.
picture of it.
And I think if patient experience and employee experience gets involved with that, to see, I mean, there's ways to track, possibly, in the future. What is that patient's is their patient's experience better, because of something that they experienced, like Reiki, or that kind of thing. And so,
Well, and it's another area that the Center for Reiki Research really needs philanthropic support,
yeah. Hmm.
because that is one of the issues with the research, is that there is really no funding for it other than private funding.
Right, exactly. Yeah.
Yeah. And so just making a plug for the Center for Reiki Research
Hmm.
and their philanthropy needs. They do such a phenomenal job
Hmm.
with their qualifying
Hmm.
the studies, and
Yeah.
really making sure that the information is accurate information,
Hmm.
relevant, current.
Hmm.
Yeah.
Yeah. Yeah. And I invite anyone who views this to maybe attend the conference, see what it's like. And there's podcasts too. We did a podcast. I did a podcast in November with them, I believe. So they do podcasts as well. So, and just being involved in that kind of thing, having the access to the literature, that you can maybe make a portfolio. I think portfolios are great. Whether it's an online portfolio or it's paper, you know, in a notebook. But to be able to share that information when you're trying to you know connect with you know institution that might support a program like this. So yeah,
I liked that you likened it to a job interview. Come in
yeah, oh yeah,
professional, come in with your binder, with your information, with
yeah,
things that you can leave with them. Like you
yeah.
said, a PowerPoint if you need,
If
uh,
you're thinking of teaching Reiki, a curriculum,
and
and
curriculum. Oh,
a
that's
manual and those kind of
okay. That's a really good little
yeah,
tip there too.
yeah,
Curriculum. Okay, yeah. That's
yeah,
yeah. I think that's
Dress appropriately.
yes,
hmm
dress
yeah,
appropriate.
definitely.
It
And
seems like it should be easy, but
standardization is important.
Say that again.
Standardization is important. I know
Okay.
I know Reiki is a healing modality that you wouldn't think of standardization, but when you're in a hospital setting or a medical setting, the standard operating process is going to help everyone feel more comfortable.
Okay.
And you can hold people accountable. If you're not sticking to that, then, let's talk, and make sure that you do. And we want to make sure everybody's comfortable, and that we, are looking at our ethics and looking at our process and looking at how we integrate, and become part of that team. We're part of the team. They come on to volunteer, hey, and they're there for the day, and they're part of that team. So, yeah.
Well, I think that's a really important piece of it, to understand that you're moving into their system, not
Yes,
asking them to move into your system.
absolutely, absolutely. And that the patient's welfare comes first. And if we have to step out of the way, or we need to leave, or the session needs to be terminated, we do what's best for the patient and the staff. And we're supportive of that. So, you know,
Mhm.
so yeah.
Yeah, absolutely.
Well, Kate, you are located in Cincinnati, Ohio, right? If
Oh
the
no, Cleveland.
Cleveland, Ohio,
I
sorry.
went to school in Cincinnati.
Yeah. Um, so if anybody is interested in volunteering in
Oh
this
yeah. Hmm.
system, that's listening to this,
Hmm.
how do they go about doing that?
So I they can contact me, and then I would get them to the volunteer departments. They have to onboard as a volunteer. They can take the class while they're doing that, and then yeah, you make a commitment to volunteer. So
Yep.
it's a free training. It's offered free of charge. It's part of the philanthropy program. Again, another shout out to the Connors, uh, who uh, donated and created this program. Uh, and then, so then the commitment is, there's always an energy exchange with Reiki, right?
Abs-
So some people pay for Reiki, some people pay for the training. We offer it free of charge, and the energy exchange is you come back and you volunteer.
Okay.
And so that's, yeah, it's amazing. So, yeah.
And also looking for those of you that are not in Cleveland,
Hmm.
looking area because there are other hospital
Oh,
systems,
yeah.
medical systems that are doing this. Are there any other K that because you're in these circles that you know of that in like some of the bigger cities off the top of your head? If not, that's fine. Just
Off the
curious.
top of my head,
Yeah, that's okay.
that have volunteer
Put on the
programs.
spot.
Uh, Mm, I can't think off the top of my
No
head,
problem.
but I would just say, check with the volunteer department, see if there's a program. If not, maybe see if there's an interest in starting one. I think that's a good way to start. Is, do you already have a program? Uh, and check it out, and again, like usually cities have more than one healthcare system, and you approach one, and perhaps that one doesn't work, and you know see what the options are. So, yeah. So,
And there are, for those that are listening, if you're not in that area, there are others out there. So definitely look in your city that you might live in or a
yeah.
nearby city to see if
and
there's one around.
it could be a nursing home.
Yeah,
It could be any. It doesn't have to be a big hospital setting
that's
either.
true.
It could be, perhaps, in a doctor's office,
Yeah.
that kind of practice. Um, so there's so many opportunities, out
And
there.
you hear a lot of it in oncology too. So that's another
Yes,
to
oncology.
even oncology.
Yeah, definitely. Um, yeah. So, just so you know, the Connors, I'm just gonna say it's Chris and Sarah Connors, who have, you know, um, been so selfless to be able to provide this philanthropy and support Connor Whole Health. So appreciate that.
Go ahead and say the full name again to make
Uh,
sure people
oh,
can hear exactly who it
yeah.
is.
Sarah and Chris Connor
And
are
Connor
the
Whole Health.
Connor family. Yeah, Connor Whole Health. Yeah. So,
And that's the name of the hospital?
well, it's University Hospital Connor Whole Health. So we're
Okay.
the whole health aspect. So, and
Within
it's
the
it's
university.
growing. Yeah, and there's so many aspects to it, but Reiki is one part. So,
Okay.
so yeah.
Well, and
And
I know when I was kind of checking into all the information for you, they
Mhm.
have a pretty good LinkedIn page too.
Yes. Yeah. You can always join the LinkedIn page. So,
Mhm.
And there's other modalities within Connor Whole Health,
Mhm.
right? So if
Yeah. Mhm.
is there like nutrition and things like that are a part of
Yes,
it that
we
people can
have
volunteer
we have
for?
uh,
Integrative.
integrative consults,
Okay.
lifestyle medicine.
Okay.
So we have massage, chiropractic, acupuncture. There's outpatient and inpatient music therapy. We do have a yoga therapist instructor, and we have health coaching now. Um,
Wow.
and a lot of different classes. They're actually um, adding classes all the time. So it's amazing. And I'm trying not to forget anyone. And
Art
the
therapy, did I see art
oh,
therapy?
they have art therapy. Yeah, that's
I thought
mm,
I saw.
amazing. So if no one has ever done art therapy, music therapy, I believe we have one of the biggest music therapy departments in the U.S. So
Wow, really?
Did you play an instrument? Is that what you were going to go?
yes,
What did you play?
I played the oboe and English horn.
Oh, okay.
But just decided that playing for grade wasn't what I wanted to do, and
Yeah.
I was very competitive, and I'm not a competitive person, so I went into the healing arts, which was really before I ever got interested in music. Besides caring for my family and caring for the kids I babysat for, I was a volunteer in child life and
Wow.
as a
Okay.
high school student, and
Good.
my senior project was at a Cleveland Musical School Settlements preschool and their music therapy department as well. So yeah,
Nice.
so yeah, so
What a big heart you have.
oh, thank you, thanks, thank you for having me on the podcast. And,
Thank you.
so,
And Kay, you're mostly just on LinkedIn, right? So,
yes,
okay. So people
yeah,
can find you on LinkedIn.
hmm
We do have a lot of people that are on here that are on LinkedIn, especially if you're in the medical fields. Most
yeah,
people in the medical field are going to have a LinkedIn. So that's a perfect place to connect with you at.
yeah. And then I don't know if um, when you post the podcast, you could put my information. I'll make sure that that's okay to do.
Oh, yeah.
Yeah.
Perfect.
Yeah.
It's good. 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 Yes, we're happy to post your information as long as it's okay for
Yeah.
what you need.
Yes. I'll check to
Yeah.
make sure.
Yeah, definitely.
Yeah. So,
All right. Well, is there anything else before we wrap up?
um, just that, if you have an interest in really, you know, receiving as you give, um, Reiki is the perfect vehicle. And if you have any, motivation to just help people to feel better, to just journey with people and be a witness to the wonderful things that happen with Reiki. It's a great experience. It's a great modality. It's um, you know uh, a way to create community if you want to be involved in you know with great people who are all on the same path. Yeah, feel free to look into it. So yeah.
Mm. Well, thank you so much, and thank you to all our listeners, and just what a an important and valuable conversation today.
Yeah.
So thank you so much.
Yeah.
Thank
Thank you and all that you do. And shout out to the same people that you shouted out to.
you.
The philanthropy and the Center for Reiki Research and all the people that are doing this important work and to you too, Kay. I know that you are really kind of leading the way and the example of what this can be. And that's
Yeah,
so
and
important.
thank you for doing what you do with the podcast, because it gets people involved and motivated and excited about you know this wonderful modality. So
Yeah.
yeah.
Absolutely. And I do want to just say verbally, we'll put it in the show notes too,
Mhm.
but there's another, the Center for Reiki Research has another conference in October
Yes,
of this year of 2025.
yes.
So
Yeah.
just
If you
wanted to,
can attend, it's all online, right? It's not.
It was last time, yeah. I highly recommend it as well. It
Yeah.
was so informative in a lot of different
Hmm.
ways around everything that everyone's doing.
Yeah, yeah.
Yeah,
And if nothing else, like the self-care aspect of Reiki, they cover that as well during the conference. And I think last year they did several self-care options as
as
well.
far as I remember, yeah.
I think so. Yeah.
There was a lot. It was there was a lot of people that I was excited about to watch their presentations, and it's not all just medical settings, but there's, a variety of different things. So if you're interested in this kind of view, or this is the part of
Yeah.
Reiki that you've been called to, that
Yeah.
idea of just all of us being energy, biofield therapies, medical science, I
Mhm.
highly recommend it because there's a lot of different perspectives.
And you'll connect with people. There'll
Yeah.
be a way for you to connect. There's chats. You can exchange emails. I saw a lot of that going on during my presentation. So people contacted me, and other people contacted other people. So it's a way to connect and create community as well. So
Yeah.
Well, and that community part of it is we are seeing that grow globally through all these opportunities and connections.
yeah, it's pretty
Mm,
amazing. So
yeah. Okay, well, thank you, and thank you to all who listen.
have a nice day.